Hello everyone. In this video I am going to talk about Part D, and the specific topic is going to be getting help paying your health and prescription drug costs. I'm on page 83 of the Medicare and You book. Please open your book and let's start on page 83. What if I need help paying my Medicare prescription drug costs? If you have limited income and resources, you may qualify for help to pay for some healthcare and prescription drug costs. Extra Help is a Medicare program to help people with limited income and resources pay Medicare prescription drug costs. You may qualify for Extra Help if your yearly income and resources are below these limits in 2019. Single person, yearly income less than $18,735 per year, and you may not have you cannot have more than $14,390 in your bank accounts, for example, one place, or stocks and bonds, mutual funds. Now, if you're a married person living with a spouse and no other dependents, you cannot make more than $25,365 for yearly income. And you may not have more than $28,720 per year in accounts. These amounts may change in 2020. So when they publish this book, they use the previous years, okay? These amounts may change in 2020. You may qualify even if you have a higher income, like if you still work, live in Alaska or Hawaii, or have dependents living with you. Resources include money in a checking or savings account, stocks, bonds, mutual funds, and individual retirement accounts, IRAs. Resources don't include your home, don't include your car or household items like a burial plots up to $1,500 for burial expenses per person, or life insurance policies. If you qualify for Extra Help and join a Medicare drug plan, you will get help paying your Medicare drug plan's cost, and you will not have a late enrollment penalty. Note, Extra Help isn't available in Puerto Rico, the U.S. Virgin Islands, Guam, the Northern Mariana Islands, or American Samoa. See page 88 for information about programs that are available in those areas. We're on page 84 now, the blue box. Most people with Medicare can only make changes to their drug coverage certain times of the year. If you newly lose, or have a change in your Medicaid or Extra Help status, you may get a special enrollment period to change plans. Check with your plan for more information. Bold black. You automatically qualify for Extra Help if you have Medicare and meet any of these conditions. You have full Medicaid coverage. You get help from your state paying. You get help from your state Medicaid program paying your Part B premiums in a Medicare savings program. See page 86 and 87. That's coming up. You get supplemental security income, SSI benefits. So if you have one of those three, you already get Extra Help automatically. To let you know you automatically qualify for Extra Help, Medicare will mail you a purple letter that you should keep for your records. You don't need to apply for Extra Help if you get this letter. If you aren't already in a Medicare drug plan, you must join one of these. You must join one to use this Extra Help. If you're not enrolled in a Medicare drug plan, Medicare may enroll you in one so that you'll be able to use the Extra Help. If Medicare enrolls you in a plan, you'll get a yellow or green letter letting you know when your coverage begins, and you will have a special enrollment period to change plans. Different plans cover different drugs. Check to see if your plan you're enrolled in covers the drugs you use, and if you can go to the pharmacies you want. Visit medicare.gov/plan-compare or call 1-800-MEDICARE to compare it with other plans in your areas. Now, if you have Medicaid and live in certain institutions like a nursing home or get home and community-based services, you pay nothing for your covered prescription drugs. Continuing on page 85. If you do not want to join a Medicare drug plan, for example, because you want only your employer or union coverage, call the plan listed in your letter or call 1-800-MEDICARE. Tell them you don't want to be in a Medicare drug plan, you want to opt out. If you continue to qualify for extra help, or if your employer or union coverage is credible prescription drug coverage, you won't have to pay a penalty if you join later. Important. If you have employer or union coverage and you join a Medicare drug plan, you may lose your employer or union coverage for you and your dependents, even if you qualify for extra help. Call your employer's benefits administrator before you join a Medicare drug plan. Drug costs in 2020 for people who qualify will be no more than $3.60 for each generic drug and $8.95 for each brand name drug. Look on the extra help letters you get or contact your plan to find out your exact costs. But that's a very good benefit thing to know. You pay $3.60 or $8.95 for prescriptions if you qualify for this extra help that I'm going over today. If you didn't automatically qualify for extra help, you can apply anytime. Visit socialsecurity.gov/I-1020 to apply online. You can also call Social Security. Note, when you apply for extra help, you can also start your application process for the Medicare savings programs. These state programs provide help with other Medicare costs. Social Security will send information to your state unless you tell them not to on the extra help application. So just information, I am on the next video that I go over, I'm going to go over the Medicare savings programs. So please, when you're done with this video, go to that one. Turning the page. This is what the Social Security, I'm going to go back. Do you see this blue section that says socialsecurity.gov/I-20? If you click on it, this is what's going to pop up. You're going to go to it's going to take you to the Social Security website, and it tells you right at the top, the official website of the U.S. Social Security Administration. Extra help with Medicare prescription drug plan costs. Welcome. The Medicare prescription drug program gives you a choice of prescription plans that offer various types of coverage. You may be able to get extra help to pay for the monthly premiums, annual deductibles, and co-payments related to the Medicare prescription drug program. However, you must be enrolled in a Medicare prescription drug plan to get this extra help. So again, it's going to help you pay with those monthly premiums for your Part D, the deductibles of your Part D, and the co-pays for your Part D. That's very good. What is this application? This is an application for extra help and does not enroll you in Medicare prescription drug plan. You will have to enroll directly with an approved Medicare prescription drug provider for coverage. If you need information about Medicare prescription drug plans or how to enroll in a plan, call 1-800-MEDICARE. Now, who should complete this application for extra help with Medicare prescription drug costs? You should complete this application for extra help on the internet if you have Medicare Part A hospital insurance and or Medicare Part B medical insurance, and you live one of the 50 states or the District of Columbia, and your combined savings, investments, and real estate are not worth more than $29,160. If you are married and living with your spouse, or $14,610 if you are not currently married or not living with your spouse. Do not count your home, vehicles, personal possessions, life insurance, burial plots, irrevocable burial plots, or back payments from Social Security or SSI. If you have more than those amounts, you may not qualify for extra help. However, you can still enroll in an approved Medicare prescription drug plan for coverage. Exception. Even if you meet these conditions, do not complete this application if you have Medicare and Supplemental Security Income, otherwise known as SSI, or Medicare and Medicaid, because you automatically will get the extra help. How can you get the extra help? Turning the page. So that concludes this portion of this application of the extra help, getting help paying your health and prescription drug costs. In the next section, I'm going to go over the actual application on the socialsecurity.gov website. So please click on. Thank you very much. Have a beautiful day.